Coffee is one of the most widely consumed beverages in the world, celebrated not only for its stimulating caffeine content, but also for its rich array of bioactive compounds, antioxidants, and flavor complexity. For many, coffee is more than a drink. It is a ritual that signals alertness, focus, and energy. Scientifically, coffee's benefits extend beyond wakefulness, influencing metabolism, cardiovascular health, liver function, and even longevity. However, the effects of caffeine are nuanced, particularly in individuals with high consumption habits, where its interaction with hormones, sleep patterns, and insulin sensitivity can become more pronounced. Understanding these dynamics highlights how coffee, when consumed thoughtfully, can be both metabolically supportive and enjoyable. Caffeine, the primary bioactive component in coffee, functions as a central nervous system stimulant. It blocks adenosine receptors in the brain, which reduces feelings of fatigue and increases alertness, concentration, and reaction time. Beyond the immediate energizing effect, caffeine also influences cortisol, the body's primary stress hormone. In moderate amounts, caffeine can transiently increase cortisol levels, enhancing alertness and mobilizing energy substrates such as glucose and fatty acids to support activity. This effect can be beneficial, particularly in the morning when the body is naturally primed for cortisol-mediated wakefulness. For athletes or individuals engaging in high-intensity activities, this temporary cortisol elevation can improve endurance, fat oxidation, and mental focus, demonstrating how coffee functions as a metabolic tool when consumed strategically. High consumption habits, however, can shift caffeine's effect on cortisol and energy balance. Drinking coffee late in the day or in excessive amounts may prolong elevated cortisol levels into the evening, potentially interfering with the natural circadian rhythm. This can affect the ability to fall asleep or achieve deep, restorative sleep cycles. Yet, even in these scenarios, coffee retains significant metabolic value when consumption is timed appropriately. For instance, limiting intake to earlier in the day allows caffeine to support morning alertness and cognitive function without disrupting nighttime recovery. Sleep disruption is primarily a matter of timing and sensitivity. Moderate, well-timed coffee intake generally does not impair long-term metabolic function, and many habitual coffee drinkers adapt to repeated exposure, experiencing only minimal impact on cortisol rhythms. Caffeine's influence on insulin sensitivity and glucose metabolism is another important consideration. Acute caffeine intake can slightly reduce insulin sensitivity temporarily, meaning that after drinking a strong coffee, the body may require more insulin to process glucose efficiently. For most healthy individuals, this effect is transient and not harmful, especially when balanced with nutrient-dense meals and overall lifestyle factors. Interestingly, long-term observational studies often report an inverse relationship between regular coffee consumption and the risk of type 2 diabetes. This suggests that despite the short-term modulation of insulin sensitivity, habitual coffee intake, particularly when combined with antioxidant-rich polyphenol naturally present in coffee beans, can improve long-term metabolic outcomes by reducing systemic inflammation, enhancing liver function, and supporting healthy weight management. Coffee's polyphenol, including chlorogenic acid, contribute to these benefits by improving endothelial function, modulating oxidative stress, and promoting favorable lipid metabolism. Another metabolic advantage of coffee is its role in enhancing energy expenditure and supporting fat oxidation. Caffeine increases thermogenesis, the process by which the body generates heat and expends energy, which can modestly improve calorie utilization. For active individuals, this effect can synergize with exercise to optimize performance, reduce perceived exertion, and improve endurance. Coffee also supports cognitive performance and mood, indirectly enhancing motivation and consistency in healthy behaviors such as exercise and balanced eating, which further contributes to long-term metabolic resilience. The positive impact of coffee extends to its antioxidant content and cardiovascular benefits. Roasted coffee beans are rich in polyphenol and other phytochemicals that reduce oxidative stress, protect blood vessels, and support heart and liver health. Moderate coffee consumption is associated with a lower risk of cardiovascular disease, improved lipid profiles, and reduced markers of chronic inflammation. These effects are particularly notable when coffee is consumed in its minimally processed form, black or lightly brewed, rather than with excessive added sugars or creams, which can offset its metabolic benefits. Individual variation in caffeine tolerance is an important factor that underscores the importance of mindful consumption. Genetics, habitual intake, sleep patterns, and stress levels all influence how coffee affects cortisol, sleep, and insulin sensitivity. For most healthy adults, 2 to 4 cups per day offer significant metabolic, cognitive, and antioxidant benefits without causing major sleep disturbances. High consumption habits may require adjustment in timing, portion size, or method of preparation to maximize benefits while minimizing temporary disruptions in insulin sensitivity or sleep. Incorporating coffee thoughtfully into a balanced lifestyle allows it to function as a powerful metabolic ally rather than a disruptor. When consumed in moderation and paired with nutrient-dense foods, coffee enhances alertness, supports fat metabolism, improves endurance, and delivers a potent dose of antioxidants. By paying attention to timing, portion size, and personal sensitivity, individuals can enjoy the ritual, flavor, and metabolic advantages of coffee without experiencing the potential downsides of high caffeine exposure. Ultimately, coffee exemplifies how a naturally bioactive beverage can simultaneously nourish, energize, and support metabolic resilience, making it a uniquely enjoyable and functional addition to a health-conscious diet.